So in the last video, I talked a lot about setup and the anatomy and how you really can't change those things, so you kind of find something that works. But you can have soft tissue restrictions that are going to limit your squat. So how do you know is whether or not you have a sort of a bone, a block of your anatomy that you can't fix versus a soft tissue restriction that maybe you can. And that's where deloading comes in. So take a look at these two videos here to show you how you can deload using both pulleys and bands. Deloading is great because what it does is it helps us figure out if the limitation is from joint or whether the limitation is from soft tissue. So if you squat down just regular body weight and you get to a point and you kind of get stuck, okay? What does that mean? Could mean a couple things. But if you deload the movement and all of a sudden now you can drop further into your squat, then the joints have plenty of range of motion that you can go through. You're just not able to access it actively. So that's great information. So that says, no, you don't have a limitation here. You have a limitation from a movement standpoint, a muscular or a neuromuscular standpoint where your body is sort of creating a block of sorts. It's not letting you go because maybe it's sensing something in your body it doesn't quite like. So it's saying, you know what, stop right here. So it's putting the brakes on for a reason, but the deload can help you kind of both assess your ability to do something, and it also can be the first step in sort of rehabbing that motion. And actually you can start using the deloaded squat as part of your rehab or as part of your training. It also decompresses your spine a little bit, right? So if you think about a bar on your back, that's going to compress things. The deload, because you're holding on, it's going to kind of create a little bit of attraction to your back. So sometimes doing the deloaded squat, the back feels awesome while you're doing it, and you're able to squat through more range of motion, which is a win-win. The pain goes away or decreases significantly, and you have more available range of motion. That's great for you. So definitely, if you're having pain when you squat, try doing some body weight movements to assess where you can get to, and then assess that compared to your deload. And if the deload makes it better, great, then that gives you some valuable information to move forward with. Start with the deload as part of your, even if it's a bit of a warm-up, I would use that as how you squat, at least temporarily, to work on the other pieces we talked about. Work on keeping your body tight, right? Get your lats tight, get your abs tight, and then work on coming down and work on controlling that descent. The band's or the pulley will help to lift you back up, but work on maintaining your tension as you go through the motion. So all the things that we talked about so far can be practiced and utilized in the deload, which is great. So if you're able to work on your technique, go through more range of motion, and have less pain, that is a slam dunk way to start squatting. And if you practice those things, then take it from the deload to body weight, to goblet, to front or back squats, but you kind of walk through that progression, then you can get back to squatting, good weight, but not have the back pain because you've addressed these things along the way as you ramped back up to what you were doing when you did have the pain. So start with the deload as an assessment, but use it as sort of the entry point for starting to work on your overall squat mechanics.